This is Dr. Shakil Ahmed. Today I want to discuss the role of ultrasound in diagnosis of appendicitis. Please subscribe my YouTube channel named Shakil Health Society. One of the common causes of abdomen pain is acute appendicitis, which requires urgent surgical interventions. The clinical diagnosis is challenging in workup depends on the diagnostic modalities, including ultrasound. The accuracy of ultrasound for diagnosis of acute appendicitis is very high, especially with development of newly highly sophisticated ultrasound units. On the other hand, the ultrasound is easily available and the financial burden of ultrasound is much more lesser as compared to other modalities. The ultrasound can definitely rule out other suspected causes that are mimicking the acute appendicitis, such as ureteric calculus, diverticulitis, ovarian pathologies, etc. The primary aims of ultrasound is, first of all, to exclude other diseases that are mimicking the appendicitis. Second goal is to confirm the diagnosis. And the third goal is to prove that the appendix is normal. Ultrasound findings are as follows. First of all, visualization of blind-ended tubal structure with a diameter of 6 mm or more. Second, tender with probe pressure. The area of appendicitis, especially the RIF, or the area lying over the inflamed appendix will be tender. The tube will not be compressible. Fourth, there may be presence of calculi or appendiculi. Fifth, increased vascularity due to inflammation. Sixth, loss of gut signature or loss of stratification. Seventh, hyperechoic periappendicular tissue in response to inflammatory changes. 8. Complex fluid collection. 9th, the presence of mesenteric lymph nodes and a periappendicular fluid collection. In this image, we see that there is a calculus lying in the lumen of the appendix. This is also appendix blocked due to the presence of the stone and with a thickened, inflamed wall. This is the typical presentation of blind-ended tubal structure surrounded by a thin layer of a fluid. This is the transverse section of the tube with increased vascularity and increase the diameter. In this image, we can see the cross section of the appendix, which is inflamed with hypoechoic thick wall, and the diameter is more than 6 mm. Here, the appendix is surrounded by hyperechoic tissue and some fluids are present there. Thank you very much for watching. Please subscribe the Shakil Health Society YouTube channel.